there was a strong chance he wouldn't survive the delivery. We knew that. And we were very happy that he did.
Facing a devastating diagnosis while creating hope, a couple makes an agonizing choice for their unborn baby. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we are meeting two parents who are being extraordinarily candid about a difficult pregnancy, something many people choose to keep private. But before we get to their remarkable story, let's check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control this morning. And let's get to the COVID count. How does it look going into the holiday week?
Yeah, hi. So I'm not actually in Whoville. We are out at Olathe still, and really want to get to this special story, so I'll be very brief. Right now, we have 26 active COVID patients in the hospital. Unfortunately, I think 4 in the ICU as well. That number is down, but I think we need to continue to be vigilant. And my main message is going to be protect yourself and your loved ones. There are several big things that you can do to help that, several broad strokes that you can do. The first one is get vaccinated. If you haven't, you still have time to do that. Get your updated flu and COVID vaccines. If you are of age for the recommended RSV vaccine, please get your RSV vaccine as well. Know your environments, know where you're going to be, those get-togethers that you're with. Understand, is it outdoors? You know, it is pretty warm right now, or is it indoors? Good ventilation. If you do have symptoms, please test early. And if you are positive, have a plan to talk to your medical provider to get on those oral antiviral drugs. Remember, sometimes you have to test more than one day at a time, especially for COVID. And then again, going back to knowing your environment, it is always okay to wear a mask. We know that masking does even help protect the person that wears that mask from getting infected, reduces that risk, even if people around them aren't. And of course, the one that we continue to promote is good, appropriate, frequent hand hygiene. This is with alcohol sanitizer or the soap and water. Doing this will significantly reduce your chance of getting infection, not only from COVID, but other respiratory viruses. And with the hand, it also is important to say, please try to avoid putting your hands, your fingers in your eyes, your nose, your mouth. We know that rubbing your face, we don't even understand that we're doing it sometimes, but doing all of these things will help reduce your risk of infection and hopefully keep you and your family safe through these next few holiday weeks.
All right, Hawk, thank you so much. Have a good holiday, and we'll see you in the new year.
You too. Thank you.
Christine and Abe Jacobs were thrilled to have a second child. They learned it would be a boy and picked out a name. Then, as Alexis Del Cid explains, an ultrasound changed everything.
Of the billions of people on Earth, there's no way to know or to quantify how many of those lives you will touch, or who among all these people could change the course of your life.
Alexi, that kid, he'd be in there kicking and kicking and kicking.
When Abraham and Christine Jacobs talk about their son, Alexander, they'll tell you that even before he was born,
He was very, very active.
Very active.
they knew he was a fighter with a huge heart.
You could hear it thump. It was not just a beat, it was a thump.
A perfect, strong heart, perfect arms, perfect legs, all 10 fingers, all 10 toes, all perfect. And at 22 weeks, they went in for the ultrasound. They were so excited.
And that's when we could tell there was something wrong even before they told us.
Alexander had anencephaly, an extreme birth defect. He was missing most of his brain.
When they looked at his face, the face ended here, and there was no skull. So no rounded head.
Doctors told them on the slim chance that Alexander survived the pregnancy, he would die shortly after birth. And carrying Alexander to term could put Christine's health in danger.
We were given the option to terminate at that point, which is the normal.
That was September 7th. It's a day I'll probably never forget.
Knowing that that his entire body was healthy. We had a weekend to decide.
When she did some research, we found out that there are possibilities that he could be an organ donor. If he could help others, well, then maybe that's what he's there to do.
Our hope was that if we could carry him to term, then at least he could have the potential to help others.
Christine and Abraham made their choice, and with the deepest grief imaginable, they were going to now experience an additional layer of pain. With each week that Christine grew more visibly pregnant, well-meaning people, coworkers, casual acquaintances, even strangers, would congratulate her at every turn.
That was tough.
It was difficult. It was difficult hearing those things, you know, the congrats.
And every time she had to make another choice. Was she going to explain the whole thing, dealing with the stunned reactions from the other person, or smile and pretend? There was no good way to get through it.
Put on a strong front and then come home at night and cry.
Their little family, including Alexander's big brother Ezekiel, held each other tighter.
So Ezekiel he knew something was wrong. Like he could see, you know, mom's sad, mom's crying. And he would just come up when he would see me sad. He'd come up and give me hugs and kisses and cheer me up.
The risks to Christine's health grew. At 36 weeks, she was induced.
Because he was able to survive the delivery and made it through that, that's a big part of what allowed him to be a donor. And he was perfect. That was the report we got back even from the surgeon with his organs is perfect.
He was so perfect that every organ was donated, and each of his 4 heart valves could go to a different baby.
He only lived for 4 minutes. I was able to hold him until he passed. He was never alone.
Only 4 minutes, and Alexander could save 4 lives.
Alexander means protector of men, and he has lived up to his name. And as far as I'm concerned, he's not with us today because he's just too good for this world.
And we are so thankful to have Christine and Abe Jacobs willing to join us here in our studio today, along with 2 doctors who delivered baby Alexander, maternal fetal medicine specialist Dr. Megan Thomas here next to me, and maternal fetal medicine fellow Dr. Noria MacArthur. How are you?
Good.
Thank you
Thanks
for
having us.
all of you for being here with us today. A very special story, and we're glad you're here to share it. We're also joined by Dr. Sean Coomer. He's an Associate Chief Medical Officer for the University of Kansas Health System and a transplant surgeon who helped organize Alexander's organ donation. So we'll talk to you here in just a moment. Dr. Coomer, okay? All right, Christine and Abe, you said that Alexander was a fighter, and just watching that video piece, it's clear to see where he gets it from. You're both fighters too. It's been 1 week and 1 day since he was born. How are you processing all of this?
Slowly. It's the best way you can progress is to realize the surroundings that are around us, but we're doing as good as we possibly can at this time.
When I saw the video, I couldn't help when I saw that when they played it for us yesterday, there was this beaming, it was like I saw this beaming pride in your face when you were talking about Alexander. Talk to me a little bit about that, and I know he's a hero to you and so many.
Yes, I guess up until the delivery and getting the word back from the surgeons, there was just a lot of unknown for me. You know, we didn't know if he would survive delivery. We didn't know if he would be accepted as a donor. And after we got the word back, it was very comforting. And I guess it was just knowing that he's able to do something really great with his life.
Abe, was it comforting in those moments?
I would say it was better. It was the hope that we had actually kind of came true, and I was beaming because he was still my son, and he made it.
He did.
He made it.
So had you ever heard of anencephaly? I know I had not. Had you heard of this before Alexander was born?
I had, because I had a friend actually a few years ago. She had a daughter with the same condition and went through the same trial that we had to go through, and so it's not that we're the only ones in the boat. in this situation. It's kind of a rare case that a friend of mine actually had this, but she also went to full term, and she kind of gave me hope as well.
So you go for the ultrasound at 22 weeks. You're doing what all parents do, checking out the baby, seeing what he looks like and how he's doing. But you sensed this, there was something wrong. Did you sense something beforehand, or was it just when you saw the images?
Just when we were at the ultrasound, and our ultrasound tech was, going through all the different body parts, but normally you start with the face and the head, and she kind of rushed through that, and we both noticed, we're like, something wasn't quite right, because we saw his face, but we didn't see his head. But it didn't really hit until the doctor came in and did confirm it.
Because you have a son already, and so you've been through this before, so you kind of were knowing what to look for in those images. Will you take us through the conversation that you both had when you decided to carry Alexander to full term?
So it was a discussion. Our doctor gave us, our options. She didn't persuade us either way, but she told us what our options were. And for Abe, it was like a no-brainer decision. For me, it was a lot more complicated, because I guess up until that point, I thought I probably would terminate, just because of my age and the risks, and I'm a scientist, so it made more sense that way, until we were faced with that decision. And what was most impactful for me was when our doctor told us the process, and she said that in order to terminate at that point, at 22 weeks, it means that the doctors have to inject his heart with potassium chloride, and they have to stop his heart before a delivery. And for me, so I'm a forensic psychiatrist. I've worked in prisons and with inmates, and all I could think was potassium chloride. That's a lethal injection that we give to death row inmates. And I don't know, I couldn't handle the idea of, that being how this innocent life ends.
You were not ready for his heart to stop beating.
Exactly.
And there are 4 other families who are so grateful that you were not. And it was interesting, because this is not a decision that anyone would take lightly, right? And and you had to take your own health into consideration, because you have a son, right? You said that this was a choice that you knew right away, Abe, that you wanted to do. Why so?
Because of our other son. He's such a good kid, and I don't know if it's for our parenting or anything, but we have a good environment. I think we have a good environment to raise him in. But I don't want to lose that chance of him actually being able to do something for others, or prove himself. We thought possibly the instrumentation that was being used, it could be faulty. So there was always that chance, but more than likely it wasn't. But I did not want to play the role of God and stop my own son's heart from beating, or basically terminating. I don't know how to put it. There's no easy way of calling it what it is.
And I love how you mentioned how Ezekiel has a destiny, your one son, and now Alexander has one as well. How common is anencephaly? I mean, we're just hearing 2 cases of it right here, but pretty uncommon?
Well, about 1 in every 5,000 pregnancies can be affected by anencephaly. So it is interesting that Abe had another friend that had a child with this. Typically it's caused by a folic deficiency, folic acid deficiency in pregnancy, and that's why prenatal vitamins do have folic acid in them. And that is why a lot of our foods are fortified with folic acid to help prevent this.
And what was your diet like? I mean, you've had a baby before. The doctors always say, up your folic acid. How do you know you're getting enough in, doctor?
I think the biggest thing is we do recommend a standard dose in pregnancy, and that is what is in a prenatal vitamin. So if you take a prenatal vitamin, you should get enough folic acid.
So is that the only cause, or are there other things that could cause it?
That's a really good question. I think there are cases of folic acid resistant neural tube defects, and that is something that is currently getting researched. We don't know a lot about that.
Still learning more.
Yes.
So Dr. MacArthur, what would her prenatal care look like now that she's made this decision?
Yeah, so I mean, for Christine, we did, frequent monitoring. One of the complications that can happen with anencephaly is the baby doesn't have the normal sort of prompt to swallow and process amniotic fluid. So towards the end of pregnancy, Christine would have more amniotic fluid than normal, and that could get uncomfortable. So there were a few times where we actually removed amniotic fluid to, one, make Christine more comfortable and also reduce the risk of things like preterm labor, which can happen.
So we know that anencephaly can be fatal, and those often end in miscarriage. Are they always fatal? And in what cases do we have any sort of stats on that?
Yeah, there are cases of anencephaly where the baby lives longer, but that is extremely rare. And actually, if you look at some of those cases, I would argue that the diagnosis of anencephaly is not really anencephaly.
Gotcha. Okay, so they may have a little bit longer life to them, but
Yes.
not always, and not typically. But in this case, Christine and Abe, your son lived for 4 minutes, potentially saving 4 lives by donating 4 heart valves. Did you even know that it would go that far? I mean, did that meet or exceed your expectations of what Alexander could already do in 4 minutes?
Well, we would have loved for his other organs to be able to be used for transplant as well, but we were prepared beforehand that it wasn't likely, and we were told the heart valves would be the biggest possibility, and so when they said they were able to use the valves.
And Abe, you knew it because you heard that heartbeat really strong.
Yep.
So you could not have come to a surprise that he was going to be able to go on, and that beating heart that you didn't want to stop was going to save 4 babies.
Mm-hmm.
How exciting was that for you?
It was exciting. In my family, there's some heart problems that kind of run in the family, and so to hear that thump, luckily I don't have any heart issues myself, and for my son Alex, for him to have that thump all the way to the very end, it was amazing. It was amazing to hear.
A really good sound. Dr. Kumar, pretty amazing story. You do this all in a day for you when you do transplants and hear these stories, but how often have you heard a story like this one?
It's pretty rare and pretty incredible. This doesn't happen often, and I know that the local Midwest Transplant Network has done this before, but it's not extremely common.
So what's your role? You got to pick up a phone and call people and kind of coordinate the recipients for Alexander's heart valves. How does that work?
So obviously Dr. Thomas had the relationship with the family, and a close relationship, and they had discussed this, and Dr. Thomas reached out to her chair, Dr. Winnicky. Dr. Winnicky called me, basically because of my history of being a transplant surgeon and serving on the board at Midwest Transplant Network. We were able to make the right connections, and the counselors were able to spend some time with the Jacobs family, and they actually came back and told me that they were so impressed by this family. The resolve, the goal that they had for Alexander felt so strong to them in just a short interview with them initially. So we had to make this happen the best way we could. So in the background, we just organized the operating room. We knew there was an approximate window this would occur, and we got the right people there. And Alexander gave a gift of life to others. Pretty incredible.
Incredible. And I understand Alexander's other organs were donated to research. How might those organs help advance science in the future and help other transplant recipients down the road?
No, it's a great question. So this research, lots of things that happen in research we don't see for years. And they come down the line, and things that are discovered with these cells and these organs could save somebody's life 5, 10 years down the road. So it's a gift that we'll keep on giving for a long period of time.
Christine and Abe, who have you been leaning on? How it's been, I mean, it's not just been a week, it's been since you found out at 22 weeks. How have you leaned on each other and others in your family, in your circle?
So I've leaned on Abe, I think, the most. And then I have a couple of close friends that have helped me through. I didn't tell a lot of people right away. I did have to tell my work, which was very difficult, and they were actually very supportive.
Abe?
We had a lot of support, and having Ezekiel at home, I'm still a father no matter what, so I got to keep going. With our situation, and with anybody who would have a similar situation, the world doesn't stop for us. It doesn't stop for anybody. And so we had to keep going on, and so I had to be strong for Christine and to continue on for Ezekiel, because what Ezekiel needed to do is also be strong for Mom, to take care of her, and that's what we just had. I just had to do a drive on for myself and for my family.
And you mentioned that others go through similar situations or might have to terminate. And you're having another child at home. Do you mind if I ask how you spoke with Ezekiel about this and what those conversations were like? It might help another family.
So we don't baby talk to Ezekiel. He's a year and a half, but he has a very good understanding. And we just sat down and told him as best we could what was going on. And I know that he will understand, and in at least some of our photos, so Ezekiel did get to meet his brother, and you could see he was sad too.
Yeah, he's a tough kid. He's holding down the fort in our office back
Yes,
there. I
is.
met him
Yes, he
earlier.
is.
He's a cool kid.
He's a very tough kid.
Abe, any advice you might have for a parent going through that and those conversations you might have to have with other siblings?
Just keep going. Just keep going. It's not an easy choice. There's no way to sugarcoat it at all. Just keep going and know that you will have support. It's not that you have to go find support. It's that support will find you when they understand the situation and the enormous pressure that comes with it. The support will actually come and find you. And so for the other parents, I would say that the support will find you, and it will be there for you. There's many doctors and other families who have gone through this. The Midwest, the MTN, they provide us with a care package that also other parents help provide some goodies and some feel-good items. And so they're out there. There's support out there. But like I said, you can't stop, because the world won't stop for you. And for you to give up is a little selfish act, and we can't be that way if we want to have the world continue turning in the right way.
Well, and speaking of support, I want to ask our doctors here, just what are those conversations like when you're trying to help a couple like Abe and Christine make a decision like this?
I think ultimately you want to have a supportive kind of relationship with the patient, frank conversations, identify what they want, because it's not my choice, it's the patient's choice. And then try to find a way to make their wishes come true. Not always easy, but it can happen.
Dr. MacArthur, what was that like, walking this road with this couple to this ultimate decision?
Yeah, absolutely. They say there's some patient cases that you'll carry with you for the rest of your life, and especially as a trainee in fellowship, having the opportunity to participate in Abe and Christine's care and participate in Alexander's delivery, and even be there for the procurement of Alexander's organs was such an incredible experience for me as a trainee, and I will never forget you guys, and I'll never forget Alexander. It was really special.
Well, if you have any comments to share or a question for our guests today, you can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. The info is right there on your screen. Let's get to some questions though from our viewers right now while those are coming in. Lisa is asking, did Christine need more testing to confirm the diagnosis, or was it just the ultrasound that was necessary to identify the anencephaly?
you want to talk?
I would say the ultrasound was enough. I was offered to get an MRI. Apparently, you can actually do a fetal MRI, but it was enough with the ultrasound, and we did get a second ultrasound before we moved forward as well. But every ultrasound after still showed it.
So Angie has a question. When it comes to organ donation, Alexander's heart was so strong. Was there a reason the whole heart wasn't donated? And I don't know if that's a question for Dr. Coomer. Can you give some insight on that?
Sure, I'd be glad to. So in these situations, not to get too far in the weeds, the baby at term needs to be at least 5 pounds to utilize the heart valves, because it's basic size. And when it comes to donating whole organs, there has to be a recipient on the other end. And this is very uncommon for babies of that size that need a heart transplant. And it's also technically very difficult and not really successful to do that at that age. So it's mostly a tissue donation that could be functional for somebody later in life when they have a valvular deficiency.
All right, that makes sense. Okay, I want to read a comment from Jeremy, and he says, and this is to the Jacobs, my sister-in-law gave birth to twins who both passed away within hours of birth. No one but her and her husband were able to see them while they were still alive. A worry was that afterwards that they would be forgotten, that they didn't have time to form any memories or impact on the rest of the family or the world because they were gone so quickly. So he just wanted to share that in case that was something that you felt similar about. He said it's been 5 years. We still talk about them. They're very present in their lives and memories, and he just wanted to just express his condolences and say, I love you. So, and there's other people out there going through the same thing. So appreciate you sharing that, Jeremy, by the way. How early can anencephaly be detected?
Yeah, that's a really good question. In general, with a high-level ultrasound, you can detect this in the first trimester. So by the time you reach 22 weeks, it's a lot more evident. In the first trimester, it's not so evident, so it takes a specialized ultrasound to be able to see that.
And last question is, how common is neonatal organ donation? I don't know who wants to tackle that.
I mean, you can, but it's very uncommon in my book.
Yeah, it's extremely uncommon. You know, just the timing has a lot to do with it. Size has a lot to do with it. Not a lot of recipient demand out there, so it doesn't happen that often. And I think this story is really appropriate because it shows that this was one of the first things that the Jacobs family thought about, and they pushed for, and they felt passionate about. And just like Dr. MacArthur said, my role was in the background. I won't forget this. This is incredible, and these two people are really strong individuals and an incredible family.
Well, and Dr. Coomer, I'll get us started. What, as we wrap up today and this incredible story, what's the takeaway? What do you want people watching to really get from this story, this talk, and of course this couple?
Yeah, I think we say this all the time in transplant. The heroes with transplant are the donors and the donor families. They're the ones that make this happen. They're the ones that save lives, and they're not here to see it, but they live on in other people and save their life and let them live their life and be a vibrant person in society and achieve what they want to achieve and be part of their own families.
Dr. Coomer, thanks for being with us today. Dr. MacArthur, what's the takeaway?
For me, I mean, I think just being in awe of this incredible couple and just knowing that, you know, we can support people through whatever their wishes are, and to have taken such a selfless route. And it's incredible it's only been a week and 1 day, and how much impact you all have had in your lives and in our lives has been amazing to watch.
Yeah, and just to have him sitting here with us today, very impactful. I hope you know that. Dr. Thomas, what is the takeaway?
I think ultimately having a relationship with the physician that's caring for you is really important. They were so flexible to make things happen on our end and on their end to make this a success. And so I think having that relationship with the physician is really important, and then also verbalizing your wishes. I think without verbalizing what your desires are as a patient and as a family, we won't know. And so you did an amazing job to do that.
And Abe and Christine, we appreciate anyone who shares their health journey with us on our program, but today you've done it with such grace and poise, and we cannot thank you enough. what do you want people to really take away from your story and from Alex's life?
Want to go first?
Yeah, I'll go first. Like what we've been saying, the doctors, the support, everything is there. Everything is there. It's available. Sometimes you have to look a little bit, but for any parent who would like to go through what we went through, they can. And if they so choose to terminate, I would beg the question of, could your child do what our child has done? And if so, are you wanting to make that choice to where they cannot be able to do what Alexander has done for hopefully so many?
Mom?
So for me, Alex is just going to be my forever reminder that every life has potential and value. And if he can send that message to others, then that's really the message that he can get out.
Thank you so much. You're incredible. And Alexander's brother, I can hear him out here in the hallway. So you are needed in more places than you know. So thank you again. Thanks to all of our guests. Thanks to our viewers for being with us. We will be back live with you Monday, January 8th. So until then, you can enjoy some encore presentations of some of our very favorite episodes. We will see you next year.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now, everywhere podcasts are available.